Can a broken heart kill you? Welcome back to Vital Signs, where we unpack the health topics that matter to you. Today, we're talking about something we've all felt at some point: heartbreak. Whether it's a breakup, the loss of a loved one, or even losing a job, heartbreak can leave you feeling lonely, rejected, or like there's a void you can't escape. But here's the big question: can a broken heart actually hurt your physical health or even kill you? Spoiler, it can, and we're diving into how with insights from Clinic Director Reilly Allmoslecher. Let's get started. Heartbreak isn't just an emotional ache. It can physically impact your body, especially your heart. Reilly Allmoslecher told us, strong emotions like grief, anger, fear, or even excitement elicit physical changes in your body. While dying from a broken heart is rare, less than 1% of cases, it's possible in extreme situations. Let's break down the ways heartbreak can hurt your health. First up, something called broken heart syndrome or stress cardiomyopathy. It's real, and it can mimic a heart attack. When you go through an emotionally intense event like a breakup, the death of a loved one, or even something exciting like winning the lottery, your body releases a surge of stress hormones like adrenaline and epinephrine. In rare cases, this surge can overwhelm your heart, causing the heart muscle to stop contracting normally, leading to short-term heart failure. The symptoms feel serious: sudden chest pain, shortness of breath, irregular heartbeats, low blood pressure, heart palpitations, or even fainting. On an EKG, it can look like a heart attack, but it's not. Reilly explains, broken heart syndrome is probably caused by hormonal factors, unlike a heart attack, which is triggered by a blood clot in the arteries. Grief is the most common trigger, but any intense emotion, like surviving a car crash or natural disaster, can bring it on within minutes or hours. Most people recover, but if you feel these symptoms, get emergency medical attention right away, as it can be life-threatening in rare cases. Next, let's talk high blood pressure. Heartbreak and grief put your body in fight or flight mode, raising your heart rate and blood pressure. Reilly notes, negative emotions can cause blood pressure to rise, increase vascular reactivity, and heighten the risk for blood clots. A temporary spike might not be a big deal, but if you already have high blood pressure or other heart risks, chronic stress from heartbreak can cause long-term damage. For those at risk, this could even trigger a heart attack. Speaking of heart attacks, Reilly emphasizes, stressful emotions can trigger a heart attack in people who are vulnerable. If you have heart disease or a personal or family history of heart attacks, a sudden rise in blood pressure from emotional stress could be too much for your heart. Heart attacks are serious and life-threatening, so if you're experiencing signs like chest pain or shortness of breath, seek immediate medical attention. Then there's depression. Heartbreak can leave you feeling down, and that's normal. But prolonged sadness can tip into depression, which doesn't just affect your mental health, it impacts your physical health too. Reilly shares, people with depression have an increased likelihood of developing heart disease, and vice versa. The link is so strong that anyone with depression should be screened for heart disease, and heart patients should be checked for depression. Long-term heartbreak can lead to depression, which can contribute to heart disease, the leading cause of death in the U.S. So, what does this all mean? Your mental and physical health are deeply connected. Heartbreak, grief, and sadness can physically harm your body, especially over time. If you're experiencing heart attack-like symptoms, chest pain, shortness of breath, or palpitations, get to an emergency room immediately. For ongoing heartache or grief, consider talking to a mental health professional. They can help you navigate your new normal and find healthier ways to cope, boosting both your emotional and physical well-being. Heartbreak is tough, but you don't have to face it alone. Whether it's seeking emergency care for sudden symptoms or getting support for long-term grief, taking action can protect your heart and your health. That's all for today's Vital Signs. Drop a comment below. How do you cope with heartbreak? Like and subscribe. And join us next time for more health insights to keep you thriving. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. AFC Urgent Care Joplin, located off 3rd and Rangeline behind Starbucks. American Family Care, the right care, right now.